On cannabinoids and COVID, what do the 100 plus studies say? Hello and welcome back to the Canna Education channel of CV Sciences. I'm Lex Pelger. These are the fine products of PlusCBD, and let's jump right into this one because this is a very long one. Well, one of the big reviews uses this chart to explain something a number of you pointed out. The cannabinoids downregulate the levels of the ACE2 receptors that the virus uses to enter the cell. Then you have this other quite negative review out of Germany with a string of surprising findings, saying cannabis use did not impact mild COVID-19 symptoms. People using cannabis had more COVID-19 related hospitalizations. Veterans using cannabis had reduced SARS-CoV-2 infection rates. Frequent cannabis use was significantly associated with increased death from COVID-19, and people with a dependence on cannabis had a greater chance of a breakthrough COVID-19 infection after vaccination. But these are this paper is mostly looking at changes in substance use during the pandemic, and those conclusions were only drawn from 5 human studies on the impact of cannabis and COVID. And it doesn't jive with the bulk of what I've seen. But it's certainly not all good news, so there's probably some truth to what was said in this one. So let's start with the earliest research that was done and move forward to the latest study that sparked that last video that went so hot. So, for the first study of this new weird virus when it came out, in a mouse model of COVID infection, CBD helped to lessen the cytokine storm, that inflammation in the lungs that causes so much problems. And then, in a mouse model of the acute respiratory distress syndrome, treatment with THC took them from a 100% mortality rate to a 100% survival rate. And then, in another mouse model of that same thing, they discovered that CBD helped to reverse the lung problems. They also used 3D models, and another team found that smoking high CBD cannabis may lower the amount of ACE2 in your lungs, thus lowering potential transmission of COVID-19. Then in lung cells, CBD potently lowered replication of SARS-CoV-2, and in another lung study, a mixture of CBD and terpenes caused antiviral effects against a strain of COVID. Then, in the first clinical work that I know of, the combination of melatonin and CBD helped to keep COVID patients out of the hospital. And in a related study that was quite touching in the midst of the pandemic, a study from Brazil suggesting that using CBD to prevent burnout for the healthcare workers on the front lines of the COVID pandemic. Also in 2021, some studies started using PEA, which is the endocannabinoid known for its anti-inflammatory effects and its safety, which is also in a few of the CV products as well. In a human lung tissue model of COVID-19 infection, a combination of PEA and alpha-lipoic acid reduced oxidative stress and lowered the cytokine storm. Then in lung cells exposed the spike protein of SARS-CoV-2, ultramicronized PEA, which just means like kind of nanosolubilized, that PEA reduced all inflammatory markers. And finally, in a human study of those with COVID-19, PEA reduced inflammatory markers and may have reduced the severity of the disease. So, then in the beginning of 2022, there were 5 negative studies that I want to highlight. In Brazil, a clinical trial found that daily administration of 300 milligrams of CBD for 14 days failed to alter the clinical evolution of COVID-19. Then, in veterans, any substance use disorder, including cannabis use disorder, was associated with increased COVID hospitalizations, though not death. In a retrospective cohort study, COVID patients with a substance use disorder such as for cannabis, alcohol, opioids, or benzodiazepines had a greater number of hospital admissions, longer hospital stays, and critical interventions such as ventilation support or ICU admission. Then there's another study from the UK Biobank data, which is a big public health data center that they have. Cannabis smokers were calculated to have a significantly poor COVID-19 related survival, even after adjusting for known risk factors. And for the final negative here, in people with cannabis use disorder, they had a greater risk of a breakthrough infection after their vaccination. So, now back to more positive preclinical studies. In lung cells attacked by the SARS-CoV-2 virus, THC and CBD acted as inhibitors in a dual-action manner. In tissue studies of COVID-19, cannabis extracts targeted the messenger RNA to slow viral replication, assembly, and release. And another cellular model of attack by the SARS-CoV-2 spike, CBD inhibited toxicity and inflammation, as well as protecting the cells via control of genetic transcription, those lovely PPAR nuclear receptors which deserve their own video. Relatedly, in mice with acute respiratory distress syndrome, treatment with anandamide, which was the first discovered endocannabinoid neurotransmitter, whose levels are increased by CBD, anandamide treatment caused suppression of the inflammation in the lungs, as well as the lymph nodes of the guts via beneficial changes to the microbiome and the gut-lung axis. Also, when they looked at COVID patients, they had higher levels of the endocannabinoid 2-AG, but lower levels of anandamide and PEA. So, treatment with PEA would make sense. Treatment with anandamide or CBD, which raises anandamide, would also make some sense. Finally, in a retrospective cohort study where they looked at all substance use, they found that no substance use was found to be linked with the strength of COVID-19. Can you see the data's all over the place? But what about CBC, the fresh cannabinoid? In a mouse model of acute respiratory distress syndrome, inhaled CBC reduced pro-inflammatory cytokines in the blood and lungs, increased oxygen levels in the blood, and protected the lungs. Then, in 2022, this cool study came out about which terpenes would work best with CBD to prevent infectivity. But, unless I missed my mark, they used 6 different proprietary formulations of terpenes. They didn't share which terpenes were in which formulas. So it looks like some Portuguese drug company is protecting their intellectual property, and all of us are the poorer for it. Maybe I missed it. You can look at that paper in depth. Anyway, finally, a good PEA clinical trial. In a study of 90 patients with COVID-19, PEA reduced inflammatory states, oxidative states, and alterations to the blood biomarkers. And then in a paper that blew up and somehow made a bunch of headlines, because you never know which studies are going to catch the media's attention. But here, CBGA and CBDA, the acid forms, block the entry of the COVID virus into epithelial cells, which are the lining cells of your system. Then in human lung cells and white blood cells that modeled the cytokine storm of COVID-19, CBD and THC alleviated the cytokine storm by modulation of the inflammasome, which is a great word for parties, about the big multi-protein complexes that control the inflammation of your innate immune system. So, then in this confusingly worded paper, it's an analysis of public health data found that while opioid use disorder was linked with worse COVID outcomes, cannabis use disorder had a negative causal effect, as in it seemed to help alleviate the cytokine inflammation storms. So, another hot study to do while everybody was stuck inside in 2022 was computer analysis. So, in this computer simulation of the virus, CBGVA and CBNA were the top cannabis components for binding to the virus. In this model, the cannabinoids CBG, CBGA, and CBC were best at halting viral entry and replication. In this one, it was CBN, CBNA, cannabicycloic acid, and cannabicromanin. Bonus points if you've ever heard of those last two, because the only place that cannabicromanin appears in the science repository PubMed is in this paper. There is one hit for that cannabinoid that I know of. And finally, another analysis found that the peptides produced by hemp seeds cause antiviral activities. So, back to humans. A survey from here in the EU suggested that using cannabis prevented the contagion of SARS-CoV-2. Then, in a model of infection by the virus, CBD enhanced the cellular antiviral response and increased the infected cell's rates of apoptosis, which is programmed cellular suicide. Basically, when a cell gets beaten, it can be told to kill itself so it stops spreading the infection. Then, in a human lung cell and mouse model of a cytokine storm, high CBD extracts reduced the level of pro-inflammatory cytokines, inhibited activation of the T cells, and downregulated the cytokine storm. And in terms of the vaccine, this human study found that cannabis use does not alter the efficacy of COVID-19 boosters. And that would be a worry because cannabis tends to be immunomodulatory, but more than anything, it tends to be immunosuppressant, which is a good thing for things like autoimmune diseases, but it might mean you have less of an immune response when you're getting a vaccine. And according to this one study, cannabis use didn't screw up your vaccine boosters. Also, in terms of lowering viral replication, this study used a library of minor cannabinoids, and they found that CBGA and tetrahydrocannabidiol, which is THC with a slightly shorter tail, and were the best at lowering replication rates. So, another study that found that to be true for CBDA as well as its more stable methyl ester analog. Also, combining CBDs with NSAIDs like ibuprofen inhibited viral entry into the cells. Also, a tissue study found that PEA inhibited SARS-CoV-2 and caused a 70% drop in viral infection by binding to a key protein, as well as dismantling the lipid droplets that the virus uses as an energy source. And then coming up on 2023, we had enough data for a whole bunch of human disease course studies. In patients with COVID-19, a retrospective analysis found that cannabis users had better clinical outcomes, including a decreased need for ICU admission or mechanical ventilation. And here you can insert that joke about these old bellows used to working harder through the resin. You all made that joke in that last video. Among pregnant people, the use of cannabis appeared to reduce their chances of getting COVID-19. In a review of public health data on COVID, cannabis use was associated with lower mortality rates, lesser need for mechanical ventilation, and reduced hospitalization. For one explanation of why treatment works with the glucocorticoids, which is a steroid hormone, to help COVID patients with the inflammation and disease course is because of its effects on the endocannabinoids, such as increasing their levels. Another cohort study found that cannabis users had an 84% lower odds of death compared to non-users. But in a negative finding in a cohort of adults, smoking cannabis was linked with a higher likelihood of having 2+ COVID infections. And finally, to reiterate the newest study that sparked that last video, in public health data on people with COVID, the cannabis users had lower rates of severe COVID-19 infections, intubation, acute respiratory distress syndrome, acute respiratory failure, severe sepsis with multi-organ failure, mortality, and a shorter length of hospital stay. So, as you can see, it's still complicated and we're not sure what cannabinoids might help you the most, so you're probably just best off by taking all of them, especially cannabinoid. Good luck.